Hi, I'm Chelsea. I'm a student physical therapist, and today I'm going to be talking about the tibial femoral joint in the plane of flexion. So the muscles that works on that joint are the hamstrings, or the prime movers, which are the biceps femoris, the semitendinosus, and the semimembranosus. Other muscles that also act on the joint but aren't the prime movers are the popliteus, the gastrocnemius, sartorius, and gracilis. So I'm going to be going through a couple things: passive range of motion, mobilization, stretching, and resistance exercises. So first, for passive range of motion, I'm going to have Teresa as my patient. Can you lie on your back, please? So you're going to want them supine and scooch a little towards me. And you want them fairly close so you don't have to reach over the table, and you can adjust the height. This is good for me. So for passive range of motion, I'm going to bend at her knee. You just relax, okay? And then I'm going to stabilize at the distal femur here, and then I'm going to stretch her knee into flexion from the distal tibia, like this. So I'm stabilizing the femur and stretching through the tibia. And so you just want your patient completely relaxed so you can move through that motion. Right here. So then for mobilizations, in order to increase knee flexion, you're going to do a posterior glide or an AP glide. And again, you'll have your patient supine. You're going to stabilize at the distal femur. You want your arm to be in that same plane. And then the actual hand that's going to be mobilizing will be, you're going to use your web space of your hand over the tibial plateau. And you want your arm in that direction that you're going to be pushing in, which is this way. So you're going to stabilize at the femur and compress a little bit. And then in order to increase the range of motion, you want to do a mob of 3 or 4. So you're going to take it to the end range of the tissue. And you would do 30-second bouts for 2 to 3 minutes. And next would be stretching. So in order to stretch the hamstrings that are acting on the joint for flexion, you would actually have their knee straight. Good. And I'm just going to lift the leg up until you feel the tissue tense. Don't want to go into any painful range. And then in order to, we're going to do a contract relax. So you're going to push your leg down towards the table. You're going to let them kind of lower for 3 to 6 seconds. Okay, relax. And then as they relax, you're going to stretch them further and hold it for 10 to 30 seconds. Okay, good. So for stretching, the FIT principles are 2 to 3 times a week, but they do say it's most effective to do it daily. You want to stretch, like I said, to the feeling of tightness at the end of the tissue, but no pain. Again, you have them, for contract relax, you have them contract and let them move the leg down for 3 to 6 seconds, and then they relax and you stretch it back into that range for 10 to 30 seconds. And that's technically a PNF type of stretch. So lastly, for the resistance exercise, we're going to have her do a prone hamstring curl. I found 2 articles that this first one found that the hamstring curl was a medium intensity exercise, which is one of the FIT principles that I'm going to use, and that during the leg curl, the EMG peaked during the concentric phase of the leg curl. And then in the other study, the investigators found that they concluded that the prone hamstring curl specifically targeted the hamstring muscles, whereas the razor curl targeted not only the hamstring but the glute max and glute med. So that's why I chose to do just the prone hamstring curl. So for the FIT principles, you'll want to do a strengthening exercise 2 to 3 times a week. For the intensity, for 60 to 70% intensity, she's going to do a 10 rep max for 10 sets, 10 reps for 3 sets. And there was no specific time duration. And this is a dynamic concentric exercise open chain. So enabled to instruct the patient, I'm going to have you lie on your stomach. I'm going to put first going to have you do the exercise without the weight, and then we'll do it with the weight. So you're just going to you're going to bend your knee and bring this foot towards your bottom. Perfect. And then back down. Good. So I'm going to put the weight around your ankle. So you want to try to keep the rest of your body on the table, including your hips, while you do this, so you're only using your muscle in the back of your thigh, okay? So go ahead and bend your knee and bring your foot towards your hips. Good. And then slowly back down. Excellent. And that is the tibial femoral